If you have been a user of Tally, nice meeting you. This is Mahshid Yasai. I'm the co-founder and CEO of Tally. A quick two-line background about myself. I'm a computer scientist by training. I studied at McGill and then moved to Ontario. I'm connecting from Toronto today for my first job at BlackBerry. And then my co-founder and I started our first business in 2015, which was also a software company in healthcare. And Tally started really in 2019, but um, more formally in 2020, with the initial funding coming from Public Health Agency of Canada. We built a prototype. We started interviewing doctors, nurses, and pharmacists to see if they would pay for a product like this. Then for over 2, 3 years, we're doing R&D and tweaking our voice to text technology and everything. And then we finally went generally available May of 2023. So it's been 2 years and it's been crazy. But happy to answer any questions after. So nice to meet you. Passing it to you, Harrison.
Wonderful. Thanks, Rashid. My name is Harrison Riley, and I am on Tally's sales team. I've been with the company now for over a year, and it's been incredible to be able to support thousands of clinicians all across North America, and of course, Canada, in using Tally. And in today's conversation, we're thrilled to have the opportunity to dive more into the National AI Scribe program that's funded by Canada Health Infoway and Tally's participation in this to ensure that everyone has their key questions answered. And again, thrilled for that opportunity. So without further ado, we can dive on in. So this session tonight is all about making sure that your questions about the program are answered. You have some great background into what the program entails, who it's eligible for, and many great details. So without further ado, we'll dive in. So a quick introduction about what the National AI Scribe program is. It's a very exciting initiative that's focused on an initiative to fund an opportunity to modernize healthcare in Canada. And so 10,000 clinicians are going to be fully funded for 1 year of an AI scribe license if they fall into eligible primary care categories. The goal of this program is to enable, again, 10,000 clinicians to have the opportunity to have an AI scribe funded in the efforts of reducing administrative burden and ultimately burnout by helping them reduce the constraints that they're under with regards to documentation. And so AI scribes are an incredible clinical companion for a large variety of clinicians. And our goal in this program that Tally will be participating in is to help, again, reduce that administrative burden that comes with note-taking and increase and improve the quality of care that clinicians are able to provide to their patients. This is part, and this program is a part of a broader digital health strategy. So the Canada Health Innovate program is here to advance primary care technology and across the country have a pan-Canadian approach to finding new opportunities and avenues to support providers with tech-enabled experiences to improve the way in which that they provide care. One of the most common questions that folks have around this is, what does this mean for you? What is this program? What does this opportunity have that's available to you? So first and foremost, how is Tally involved? So we are a pre-qualified vendor as part of this program. And so this program specifically is available for eligible primary care clinicians, and we'll get into the scope of what that means. For those interested in participating in the program who are qualified, you'll have the opportunity to access Tally, all of its key features as an AI scribe and clinical documentation assistant through the program. And we're very excited about what this means. Having been vetted as a pre-qualified vendor for the program, really is just a validator that Tally meets the national standards in Canada for quality and security as an AI scribe. And so, we're really excited about that opportunity. What clinicians are typically asking with regards to this program is, so am I eligible for funding? How do I register? Can I participate if I'm already using Tally? What will training and onboarding look like? So how will that be included within the program? What happens if I'm a current Tally user, if I'm approved, and many more. And so these are common questions, and we'll go through some of the key details momentarily, but this is what we've been hearing. And so we really do want to open the floor to those attending this session now to ensure that we're asking your questions. We're happy to just start off with a quick overview of some of the most common questions, but this time is for you. So curious if anyone who is on the call, if they have any pointed questions that they would like us to dive into.
While the questions are coming, and please use any of the chat or Q&A buttons at the bottom to ask your questions. We can maybe Harrison, you and I go through some of the common questions, and when the questions come in, we'll ask the questions from the panel.
Absolutely. I'm just going to pull up some questions right now. So a few common questions. So the first and foremost one, we touched on it just briefly, but who is eligible for this program? So that's a common one. I'm happy to take that, Mashida, if you'd like to as well.
Yeah, no, I can start. So there are four groups that are identified as eligible users for this funding. First is family doctors. Second is nurse practitioners. Third and fourth are registered nurse in remote communities and pediatricians in long-term care facilities. So if you are a clinician that belong to any of the four categories, you can apply. Unfortunately, a lot of the clinicians are not covered for this funding because of this restriction. When we talked to our contacts at Infoway, they just wanted to start the program somewhere and learn from it and hopefully be able to expand on it with more clinician coverage in the future. So Claudine is asking, could you let us know what data this initiative will be collecting during the trial or the reporting requirements? So Infoway, I think there is going to what I heard was that there's going to be a half term survey or evaluation that they're going to do. As part of our reporting, and I'm sure each vendor's reporting is going to be to the Infoway. We say what is the usage of each of these clinicians that are using the product, not detailed of the patient visits, but just like this clinician has been using Tali to document 200 licenses over the past month. So that usage reporting will give Infoway some numbers to work with and see how, like, if the clinicians are actually engaged and using the product. But also, if a clinician has claimed a license, but they use it less than 10 times per month, there is going to be mechanisms so that license is actually taken from them and is given to another clinician that will actually use the product. And as vendors, we are also not going to be paid if clinicians don't use the product. So we are very much aligned with Infoway and you guys to make sure that the product has value and you actually integrate it into your workflow. I hope this answers your question. Harrison, do you have anything to add to that?
No, I think that answers the question. I'll just add to it that as I think usage, so adoption is one of the most important metrics that'll be tracked as part of the program, as mentioned, to ensure that those who are actively leveraging or taking part in one of the 10,000 licenses, it's going towards someone that will actively use it. And so that is really the reason behind why they're tracking that metric, is to ensure that the program licenses are really just being well utilized and AI scribes are being used by those who really want to leverage one. And then, of course, for those who are participating, if there's any questions around, how to get the most out of the product and the usage, our customer support team will be supporting every step of the way as well to ensure that you're able to utilize it to its full capacity and make sure you're using the usage over month over month. Next
So
question.
Sarah is asking, do you have a PIA template that new users can use before implementation? I assume you must be in Alberta. Yes, we have a PIA. We can share it with you. Yes. I think, Harrison, am I right that for PIA we require an NDA?
So if there's if we so there's two different types. So there's a privacy impact or an amendment for those in Alberta. So we have a template that they can use to submit an amendment for the use of Tally. So we have a template there. And then we also have, of course, a PIA for those who are more interested in learning about Tally's privacy and security policies. So Sarah, would you be looking for the amendment document, I believe?
I think she's asking about the PIA, but we can Just the amendment. Okay.
Yep. Yep. So for the amendment, so yeah, we have our own template for that, and so we can pass that along. It's a great thing for us to have at the ready for those in Alberta who are looking forward to using Tally. So that's great.
Very cool. Lynn is asking, my clinic applied for me. Can I keep using my personal Tally account during it? What will happen to my account if you're all approved? Yes, you can continue to use your personal account. We have this commitment from Infoway that they're going to have a very quick turnaround to tell us like how many, whether the licenses that were applied to them were actually approved, because we don't know yet. And then when that is the case, if you have paid an annual contract to Tally, we'll use the remaining of your paid term as a credit. When the Infoway funding ends, then you can continue to use your paid account. So that will be credited to your account for after the funding. Mohammed Arham is asking, does Tally support audio, macro, and templates? Harrison, you can take that.
Sure, of course. So yes, we do. So all of Tally's templates are fully configurable, so they're customizable. Some of the ways that we can support that is so these macros or stamps. So what does that mean? So being able to, if you're recording with Tally, and then having that recording turned into a document, ensure that if something is mentioned or referenced in the conversation, that something specific, such as a stamp or macro, is added to the note. So we can help actually facilitate that through Tally's custom instructions feature. And so we'll follow up and send some more resources on that. But we have a feature that allows you to input in your audio macros or verbal macros, if you will, so that they show up when you're using a particular template. Um,
I
also,
want to also, if you don't mind, just saying, I don't know, Mohammed, if you have seen our web app. So I'm just pasting a link here, going to app.tali.ai/templates. Here you can actually create your templates from the ground up, and you can actually add those macros to it. So for example, some doctors I'm seeing, they add always add at the end of my notes that the patient consent is taking, or might say whenever I say what physical exam was all good, write down this big chunk of text, and then during the visit they can say all physical exam was done, and then will basically apply that change. So it gives you lots and lots of flexibility. If you go to here and try to create your template, if you need help with that, reach out to help@tali.ai. Our customer success team will get on a call with you and help you with that.
awesome. We also have a question about patient intake forms. So is Tally looking to support patient intake forms? Um, that'll be the first question sheet. And the second one is around how Tally can be used for video consults.
Um, I guess helping in patient intake forms, I am trying to understand if just repeating to making sure I understand the question is that if you have a patient intake form, being able to add it to the patient visit and the summary, if that is the question, no, you cannot upload a PDF or a form to a patient summary today, but it's a feature that our product team is working on, and I hope it will be released very soon. It's a request that's coming from a lot of clinicians. So Shrinik, please confirm if this is what you're referring to. And how can Tally be able to scribe video consult summary and CHR? So I don't know if you have seen Tally's telehealth option. So if you are using Tally's Chrome extension on top of CHR, and we have a very good experience on the Chrome extension, I recommend you do that. There is a button at the top that for telehealth. When you click on that, then you choose where your video call is happening, and then Tally will be able to listen to both sides of the conversation, you and your patient, and basically do the document, take care of the documentation from there. Try this. There's also a good article on our knowledge base. So if you just search Tally AI telehealth, you'll be able to find it. If that doesn't help, again, please reach out to help and we'll be happy to jump on a call and help you. So Mohammed Arham, but if it's audio call from computer, how it will work? I guess audio call from computer, you mean that like similar to here where Harrison and I are on this side and you might be on your side talking, is this if that is the case that the telehealth option actually helps with that. We call it telehealth to actually refer to this case where the audio is coming from the computer and the patient is not in the room with you. Yeah. Okay.
I
Ahmed Abu. Hello. Yeah, go ahead.
I just in the chat for those interested, just shared a link to our knowledge base article about the AI telehealth feature. Sorry, AI Scribe telehealth feature. And of course, if you have any further questions, you can email help@tali.ai and we can do a tutorial with you.
Amazing. Okay. Ahmed Abu Hilala. When using SOAP notes, Tally misses the vital signs, also the physical exams, especially in telemedicine. Um, I assume there is no physical exams happening in a telemedicine. Um, can you help, Harrison? What is the problem?
So it's seeming here that so for SOAP notes, it's missing vital signs and the physical assessment when using it in telemedicine. So in that case, a couple of questions or a couple of comments come to mind too. So one, yeah, is are objective findings covered in the telehealth session and those physical assessments? And then if yes, one of the things that come to mind might be if it is a telehealth session, making sure that you're using the telehealth feature so that audio for both the provider and the patient is being picked up. And then as well, if there is content that is missed and it's still in the transcript, we do actually, through Tally's great smart edit feature, allow you to make a simple voice instructed command to just ask Tally to add it into the note. And so I'll add a quick article about smart edit, but just to simplify the example, if you do a live telehealth session and then you find something is missing, but of course it is documented in the transcript of the session, all you have to do is just use smart edit, say, hey, could you make sure to include these objective vital sign findings in the objective section of my note, and Tally will add it in for you. So I'm hoping that helps.
And just a note, because our customer success team will watch this and have the QA, they're gonna please follow up with Ahmed to make sure the problem is fixed. We're gonna reach out to you directly.
Absolutely.
Okay, Shrinix is saying that in terms of intake, I mean, when we do intakes, can Tally help us do the intakes with the patient online or over the phone, or if the patient can speak on a Tally plugin and their voice-based summary can be filled in as a patient-first intake notes. Great thinking. It is in the roadmap. Hopefully, it will be released before end of the year, but no, it is not live yet, unfortunately. Um, Duan is saying licenses will be distributed among the provinces in proportion to the population and the analysis of regional needs. Correct. So each province has a portion of the licenses assigned to them. Infoway hasn't released publicly what is each province's basically share of the 10,000 license. We're only gonna know when they tell us like Ontario run out of licenses for now, and we know that all the licenses are applied, but we don't know what we have rough estimates for smaller provinces like PEI, Nova Scotia, etc., because we have been in conversations with them and we heard it from them, but we don't. Ifoway hasn't announced it publicly. Could you review the application process and the deadlines?
I actually have a visual that I can share around how to participate in the program. So I'll go ahead and just share my screen one more time. So we'll jump back in, of course, some more Q&A, but we did prepare what happens next. So if there is an interest in the AI Scroll program, and I'll of course also send this link in the chat, but it's a very simple and streamlined process. You're going to visit, so Infoway has a dedicated site, aiscribe.infoway-inforoute.ca, and so I'll link that in the chat. From there, you're going to select your province and territory to determine your eligibility and the AI Scribe vendors that are available for you in your region. If available, of course, and if you're interested in doing so, you'll select Tally AI as your vendor, and then you'll be redirected to our site where you'll actually submit your enrollment. And then we submit those to Infoway for processing, and then a funding outcome is determined in short order. And we keep you updated every step of the way. One thing to note about leveraging the AI Scribe website here and submitting your interest to submit with Tally is we do offer the ability for you to apply as an individual or as a clinic. And so on that website, we provide both options. It's super easy to submit names. So on behalf of yourself or on behalf of your team, if you have their consent to do so. I'll post this in the chat momentarily, but hopefully that helps answer your questions.
Awesome. Mohammed is saying, I already submitted, no response yet. So we have submitted a large number of licenses that came through Tally to Infoware already. When they confirm the eligibility of each clinician, then we'll directly get back to you and say you're eligible now. But at this point, we're waiting for Infoway to confirm eligibility on the Excel sheet of all the users that we submitted to them. Thanks. I think I was approved already with the AI Scribe program for Tally, although I have paid for the first year already. I don't think, Ahmed, I don't think you are approved yet because Infoway has not approved any of the licenses yet. We, if the fact that you went through the process and you submitted and you received the success email from Tally doesn't mean that Infoway has approved you. It means that we successfully received your request. We have submitted it to Infoway, and then Infoway will confirm your eligibility, and then at that point we'll confirm to you. Sarah is saying, I submitted my clinic application yesterday, but not sure I used the right ID number for each clinician. I used the Alberta practice ID, not their college license number. Will this be an issue?
So my recommendation there, given that we have been instructed to have you submit with your college license or identification, so what I could suggest is actually that you just submit again on the link and input in your college ID into submission. It's still open. You can still submit now. And so just to ensure that they have your submission with the correct ID, I would encourage you to do that.
Yeah, so if you have multiple submissions, either through one vendor or multiple, all the corrupted submission will go and the first correct submission will be taken. So if the previous ID numbers, which I assume is already submitted through us to Infoway, I think it will be automatically rejected, and then we'll have your second request going in with the right IDs. Then in form, please fix it as college ID. Okay, that's a good point. That is a great point. We'll do that.
That's great feedback. Thank you. All right. I'll just make sure we're not missing out any questions from the chat before we go into some other commonly asked questions.
So just a question, Mohammed. Is it the Excel sheet or in the form, in the web form? We don't say college ID. I was just looking in the form. Okay. I think this is a quick change. We'll do that college ID. Perfect.
Perfect. All right. I'll just pull up another set of questions for you, Mashid. We have a few more coming in.
Yes.
Okay.
I think there's a question about Supply Ontario and how the two programs correlate with each other.
Start there, yeah.
They are completely different programs. Supply Ontario is not a funded program, so you still, if you go through Supply Ontario, you still have to pay for your license. But the benefit of going through Supply Ontario, if you have had experience through the EMR world, we expect that it's going to be the same path. There might be in future some sort of certification process that coming. Right now, there's no certification, but that is more like the terms are already negotiated through Supply Ontario with each vendor, including Tally. So when you go select from that vendor list, the terms are already negotiated on behalf of Supply Ontario. I think that is the biggest value of Supply Ontario today. Whereas Infoway is the same, so the contract is consistent and already negotiated by Infoway, but there's also funding on top of that. So you can go through any of the programs, but we're seeing that a majority of the clinician right now, before the funding runs out on the Infoway side, go through Infoway. After that, I think the next best available program in Ontario is going to be Supply Ontario. I think there is going to be similar models in other provinces as well, but I don't think anything has been announced yet.
Another common question, Rashid, is also just what happens after the 12 months in the program? What can clinicians expect just with continuing on with Tally?
Um, so first of all, we're hoping that the funding would be extended beyond 12 months. We have our fingers crossed, but it's not guaranteed, obviously. If the funding is not extended, you would, if and you have already paid for Tally, as I said, you would be credited to for your license after that. And if not, you will then if you want to continue to use Tally, then at that point you will actually go through the normal subscription of the or Tally. And we're hoping that at that point for Infoway licenses will have kind of a promotion to give you discounted rate to continue to have your business. But we're just going to make that decision closer to the end of the Infoway when we know more about how their funding looks like. I think hopefully closer to Q1 2026, we'll have more updates whether the program is going to be extended or not.
Wonderful. And let's see here if any other questions are coming through. Hope they're just
So which link not working? Apply for myself or apply for my clinic? Oh,
apply for my clinic, link not working.
mm-hmm.
Take a quick look at that.
Thank you so much.
Awesome. Mohammed, we'll follow up with you just to make sure you have the right link. And I'll also email you just an intake form that we can submit on your behalf. So we'll get that sorted for you, no problem. Perfect. Yeah, thank you for confirming. Yeah, the applying for an individual license should be alive and well, but I'll make sure to send you over a form momentarily so that you can apply for your clinic. That's great. Okay, Rashid, I know we're at at the half or at the half at this point, so I'll just see if there's any other further questions. Yeah, Sarah, I'm happy to also send you a form as well. That's no problem. So and maybe that raises a good point as I'm seeing a few folks asking this question. So anyone who would need support in submitting for their clinic, feel free to reach out to help at tali.ai, and we can send you resources, so linking you to the form to sign up as an individual, as a clinic. But I will personally be reaching out to those on the call this evening just to make sure that you have the intake forms and we can get that submitted on your behalf.
I think there's just one last question before wrapping up. Licenses favored with indicators as a priority in regions underrepresented in health. I think sorry, we did answer this, right? Or is it
Yeah,
in? Yeah, we did. Sorry. Okay. Thank you so much, everybody.
that's
It was
great.
so good to have you with us this evening, and please continue to talk to us through help at tali.ai or join our community.tali.ai, and we are available. They're almost 24/7. So yeah,
That's awesome. Thanks so much for your time, everyone. And again, I'll follow up with those on the meeting this evening with resources to get started with Tally and the Canada Health Infoway program. So thank you so much.
take care.
Take care. Bye.